I've muted everybody and have taken off the permissions for people to unmute themselves just so that we don't have sound interference during the webinar. But if you have something you want to add, please do so in the chat box, or you can use the raise your hand function and I can unmute you that way. Okay, so we're gonna go ahead and we're gonna get started right at 2 o'clock. And I'm not sure that we'll use all of our time today. We have until 3:30, but we'll see how much time it takes for us to get through this. The goal of this webinar is to be interactive through the chat box primarily, just because there's so many of you joining that it's going to be difficult to have people unmuting themselves and chiming in that way. But please type in your answers and comments and feedback as we're going in the chat box. That way we can interact and do some brainstorming together about program evaluation in early intervention. Okay, so I am Jennifer Ward. I work at the Strong Center for Developmental Disabilities in Developmental and Behavioral Pediatrics at the University of Rochester. So just a brief overview, developmental and behavioral pediatrics, we offer clinical services in developmental disabilities, research, and community programs. The main community program that I'm representing today is called the Strong Center for Developmental Disabilities. And at the Strong Center for Developmental Disabilities, we are a university center for excellence in developmental disabilities. So what that means is we're one of 67 university centers, and we're a member of the Association of University Centers on Disabilities, also called AUCD. This is a network of interdisciplinary centers advancing policy and practice for individuals with disabilities, their families, and communities. And we're located at the University of Rochester. Okay, so through the Strong Center, we focus on people of all ages with developmental disabilities in our programs and services, believing that all people have the right to live fulfilling and independent lives as active participants of their communities. Today, we'll be focusing on early intervention through a program, a state-funded program called the State Systemic Improvement Plan, which is geared at improving family-centeredness. So this webinar series is part of that New York State Systemic Improvement Plan, and our goal is to improve family-centeredness in early intervention programs. Just a brief overview of this webinar series. We are hosting 10 webinars September 2019, past September, through this upcoming September. A number of them are going to be recorded, not live. This one is obviously a live version. And once this is finished, we will get it posted on our YouTube channel, which I will send out all the information to all registrants for being able to view this after the fact. And it will also be available for viewing through our website, which you'll have that information as well. So following this webinar, there's going to be a survey certificate. And in order to get a certificate of attending the webinar, you'll just have to fill out the satisfaction survey. That's the only way to keep track of everybody who is able to view this in the live version as well as the recording version. I will send the link out via email to that survey at the end, and the link will also be available at the end on the PowerPoint slides. So you can earn 1 hour of credit towards professional development requirements as outlined in the provider agreement, although for questions about this specifically, there will be somebody else that I will forward questions to, so I will include their email in the follow-up email after this webinar. Okay, so let's talk a little bit about learning objectives for today. So we're going to be talking about program evaluation, which is maybe a different a different take on the word evaluation that you hear so often when referring to the disability field. We're not talking about evaluation of disability or of diagnoses or condition. We're talking about evaluating your programs to ensure that they are operating well, that there's looking for room for improvement, getting feedback on the programs, and how you can do this in early intervention setting. So understanding the importance of program evaluation in that sense, the basics of how to conduct a program evaluation, and then how you can take those evaluation findings to improve program outcomes within early intervention. Okay, I see a lot of people writing in the chat. Attendance, there's no need to take attendance in the chat box. We will be doing attendance for the webinar through the follow-up survey. So that's just a note. And somebody else is having issues with sound. My recommendation is to disconnect, reconnect, try out, test your audio. And then if you are still having issues with sound, you can also call in on the phone and have your computer for the screen. If people would like to unmute themselves at any point to ask questions, there is a raise your hand feature, and that would be the best way for me to identify a single person to unmute. If I unmute everybody, there's going to be a lot of sound interference. Okay, so let's go ahead and get started. You can also feel free to put questions in the chat at any time as well. So what are we talking about when we talk about a program? We could be talking about an intervention, a service, something you're referring to as a program. It can be anything that's providing a service to a consumer or to the participants who are receiving it. So any examples of programs that you are specifically working on? And yes, the PowerPoint presentation will be made available after the fact. So any examples of programs that you work with, or it can be a program for direct service to the little ones that you work with, a program for families. It could be you decide you want to run a newsletter every month to families. That can also be considered a program that you'd want to evaluate. Any examples? Feel free to put them in the chat box. It'll be helpful for me too to know, just to get a sense of different programs that you guys are a part of. I'll give people a minute to type those in. Okay, so we have early intervention home care, we have county service coordination, toddler program or a parent-child group, a program specific to a county, another toddler program. So lots of different examples, whether it's serving toddlers, little ones, or providing service for parents, coordinating service, all of that, the coordination that is involved. Applied behavior analysis, lots of examples, speech, OT, PT, those are all different types of services you might provide that you'd want to evaluate. Okay, so we'll keep thinking of these programs, and as we go through this webinar, have one in mind just throughout, just pick one program that you want to kind of envision how you might go about evaluating that program, because we're going to talk a little bit about thinking about the goals of that program and how you might look at questions to ask and what you want to look for. So keep one in mind. This is super helpful. Thank you. Okay, so we're thinking about our programs. Now, what is a program evaluation? So any ideas about what that might look like? And we'll talk about this. I'll introduce all of these things as well, but any ideas on what it means to evaluate a program? And in light of that, what comes to mind when you hear the word evaluation? Okay, so some ideas coming up in the chat box. We have progress towards goals. So the word goals is a really important one. We'll talk about that. The effectiveness of a program. That's great. Family satisfaction. So thinking about satisfaction of a program. So how well are families, or is the consumer satisfied with the program? Are the outcomes meeting the objectives? That's a really good point. Carryover, improvement, development, effectiveness, measurable outcomes, outcome measures. So a lot about outcomes, of course. That's huge in program evaluation. And then I like that I saw something about satisfaction. I think that's an important outcome to look at. Great response in the chat. Are we doing what we intend to do? So is what the program says it's going to offer meeting that expectation? Okay, thank you, everyone. Okay, and then somebody else also mentioned changing what should be involved in changing the program after completed. So thinking about making improvements to the program. Are we meeting needs? Great ideas. Okay. Okay, so now many of you guys already thought of this, but here are some reasons why you might evaluate your program, and maybe type in the chat box things that you are resonating with, why you might want to evaluate the program that you have in mind, as well as other ideas on the benefits of evaluating programs specific to the program that you're envisioning in your head. So a few things that come up. We want to think about reasons to evaluate: demonstrating effectiveness. One of the chat comments was, let's see, ensuring you are meeting clients' needs. Super important. So making sure that you're meeting the needs of your clients, of the consumers. Understand the value to participants. So sometimes you might offer a program to families, and you have certain ideas about what the program will provide, but sometimes there are unexpected things that the program is offering to families. So maybe you were not expecting that toddlers were going to make certain gains in the early intervention program that you run, and evaluating it shows that they're making gains in all of these ways that you didn't foresee. Maybe some things that you thought they may have made gains in, they didn't. So sometimes understanding the value to the participants might be unexpected. It might match the program objectives, but it might not. And so evaluating it can give you those answers. Gaining confidence in your program. So we all want to be working on programs that matter to people and that provide resources and meet their needs and result in the objectives that we're hoping for. And so being able to evaluate the program and to see that, oh yes, we're doing A, B, and C like we hoped to, can give you the confidence to really be able to speak highly of the program that you're running or that you're working with, and have the confidence that it's doing what it should be. Okay, so another important aspect of evaluation is being able to find out ways to improve a program or service. So you might find gaps in the program where there are some things it's not doing that you were hoping for. And through evaluation, you can get some of those answers on how can we make some improvements to this program or service. Okay. Okay, a few other things. So why are we evaluating a program? Well, we want to verify that the program is really running as originally planned. Answer the questions: is the program really working? If not, should I change it? Should I continue it? Or should it stop altogether? Those are important questions that evaluation can answer. we also want to understand, verify, or enhance the outcomes of the program. So in what ways can we make improvements? Can we make changes, or can we keep things moving in the same direction? How can we assess the strengths, the weaknesses of the program, and areas for program improvement? So the three notes in the bottom that you'll see, the green, yellow, and red, are really prominent goals of evaluation. Do you want to continue to do this program, to offer this program? Is it meeting everything you thought it would and more? Do you need to change aspects of it? Maybe it's a new program and there are ways that things need to be resolved or improved. And then finally, is it just really not effective in the ways that you originally envisioned? It's not feasible to make all these changes to make it effective. So should the program just stop altogether? And there are a few different ways that we can look at evaluation. So the three types I'm going to talk about today. There's the planning side of things, there's the implementation, and there's outcomes. Okay, so if you're planning a program, you may want to try a formative evaluation. So formative is looking at, these are the goals I have for this evaluation that I'm planning. Now, when I do the evaluation, did the program meet the intended goals? So that's looking at the formative evaluation side of things. Are you implementing a new program? You may look at process monitoring or process evaluation. And so what that might look at is, what is the feasibility of running this program? How is it operating? What changes need to be made? How well is the program being implemented? Maybe you had ideas about having a certain number of staff work with toddlers on certain skills, or you had 3 staff identified to support with a parent program or parent support group. And what is the feasibility of implementing that program the way you originally planned? So looking at the development of the program and whether it's able to be implemented the way you wanted it to be. And then there's also outcomes evaluation. So outcomes, looking specifically at the program outcomes. Did it meet its intended goals? What is the impact of the program? And in all of these different types of evaluation, you can utilize participatory evaluation, which is the idea that you can involve participants throughout the entire process, from the design of the evaluation to being able to implement changes. And this is ideal, especially when your goal is to serve the consumer of the services better, is to involve them in the evaluation as well. So you're asking for their feedback on, how does this survey look? Do these questions make sense to you? Is there anything we need to change? And then when you get your results, or you are looking at your results and the feedback, involving consumers and involving parents and caregivers and community members that you're serving in those conversations can help you better implement the feedback and make changes to the program. Okay, so we're going to talk a little bit more about a few types of evaluation, just to give you a sense of how you might want to approach evaluation in some of the programs where you work. So thinking about process and evaluation, this compares the actual program with the planned program. So you have your planned program, and you have all these ideas about what it's going to look like and what it's going to offer, and the population that it's going to serve and how many people it's going to serve. And then you have your actual program, what actually exists. One way to think about this is, I had a planned program this summer where we were going to do an inclusive gardening program. And then we had the COVID crisis, and the actual program looked very different than the planned program. It was made virtual, there's all these different changes. And so the way that the program looks is very different than the way it was planned. many times don't have such drastic differences, but it's helpful to think about how the plans can change when you actually put these into practice. And then you have your expected outcomes or results from what was planned, as well as what actually took place. So before you start a program, there's plans for how you would operate it, the goals of how it would impact participants. Process evaluation assesses whether or not the program actually matches the plans. Are the outcomes what were expected? Are there different outcomes? Different outcomes is not always a bad thing. Sometimes your outcomes can still be great, even if they are different. So if we're talking about a family program that you ran, you might find that maybe the families didn't find connection with other families, but they felt more connected to early intervention or to their children. So the outcomes may look different, but it's not always a bad thing. Okay, so outcome evaluation is looking at the actual results of the program. What are the outcomes of the program that you're running? That's what it's going to look at. It's what are the actual results of the intervention, the program, and it determines if the actual program met those results. Okay. And then are the outcomes what were expected based on the planned program? So this is just really focusing on the outcomes, whereas process evaluation is looking at planned versus actual programming. This is looking at the actual outcome or result that took place. So this is something you might look at if you are required to share data on your program and how it met the goals of families or something like that. Or if you just want to get a sense of what are the outcomes? What is this program doing for people? This is what you might look at. Whereas with the process evaluation, you're going to want to use this if you want to see if your planned program and your actual program were in line or if they're different, things like that. And then finally, developmental evaluation is the third side we'll talk about. And that it monitors the development of a program and it helps to guide change. So it's used when a program is not quite ready to be assessed in terms of meeting outcomes. You might have a really young program and you really don't know what the outcomes are, and you're not as concerned with the outcomes yet, but you are really working on making improvements to the program and trying to solidify what that program looks like for families. So sometimes programs can benefit from making improvements, changes, and doing a developmental evaluation can be a great way to do so. It can determine which changes will benefit the program and also determine if the program needs to be overhauled altogether or maybe needs to stop because maybe it's not working. It's not functioning well for your organization. It's not functioning well in terms of the nature of the program. So this can all answer some of those questions. Those are the three sides, the three pieces of evaluation we're gonna think about today. And you can also use both. So you might have a program that's developing and you wanna look at the changes to design, but you also wanna see, well, is the planned program and the actual program, are those the same? So you might look at process and development, and you might look at all three, although when you're looking at a developmental evaluation, you really take a step back from the outcomes and you're focusing more on program change. So those two don't always work together. Any questions before we keep moving forward? Okay, feel free to put those in the chat box if you have questions as we keep going. Okay, so we're going to talk a little bit about how do we do this, right? How do we do an evaluation? How do we evaluate our programs? Well, first you're going to start by thinking about who your program stakeholders are. And this image on the right side of the screen, this is related to schools. So this is not specific to EI, but it's helpful to think about in terms of a school. You have your students, you have your teachers, you have your principals, you have all these people that are involved in the group of stakeholders. So with early intervention, many of these are still true, right? You have your your children that you're serving, parents, maybe grandparents or other caregivers that are involved. You have coordinators that you work with. You have other providers that you're collaborating with in terms of that child's unique service needs. So there's all these different sides of all these different types of stakeholders you want to consider involved in the program, and they're going to have a role hopefully in your evaluation as well. So you want to consider potential stakeholders before you start thinking about your evaluation. Any ideas on potential stakeholders specific to the programs that you are working on? Thinking about that one program that I mentioned earlier to keep in the back of your mind. What are some of the stakeholders in that program? Please put them in the chat box. I'll give everybody a minute or so to do that. Parents, definitely parents and family members. That's super important to think about that side of things. You have a community as well, right? So there's a whole lot of people involved. Oh, whoops, I think I drew on this accidentally. Let's see. Okay. We have service providers, school districts, medical. There's so many stakeholders involved when it comes to early intervention. Absolutely. Therapists, service providers. You also have funders, agency and state, fiscal, those types of stakeholders as well. And social services is another one, medical providers, extended family, child. Yeah, absolutely. Everyone directly involved with the child. It's a great point. And then there's also, it's helpful to think about stakeholders in terms of different levels. So you have your primary stakeholders, and it might be helpful to think about your primary stakeholders as the children, the families, the providers working directly with the child, and maybe other early intervention staff and providers that are working around that program. And then you have like your tertiary stakeholders, the ones who are involved in a lot of ways that may not be as directly involved with that program. So it might be like the school district or the medical providers or things like that. And so you might see different levels of stakeholders for a specific program, and that will change from program to program. Maybe in some programs the schools are directly involved, in other programs they're not. So it's important to think about the different levels as well, and always considering the participants, not just the system stakeholders, but the family, the community, consumer stakeholders are extremely important to consider. And many of you did, which is fantastic. So how do you involve stakeholders? So first we think about what is a stakeholder, which we just talked about. They're involved in the program the way the program impacts the child, the way the program impacts the family, because they're involved in the lives of the family, and they may be involved in the specific function of the program. Then to involve stakeholders, you're going to want to bring them into the conversations when you're talking about, well, what are the program goals and objectives? So bringing them into those conversations, maybe bringing a family member or a teacher into a meeting about setting the program goals and objectives. Developing an evaluation plan. Well, you want to evaluate your parent program. Great opportunity to involve a parent in helping you develop how you're going to go about doing that. Deciding how to collect and analyze the data. So maybe you're used to using surveys, but that's not the best way to really gauge a family's experience with the service that you're looking to assess. So maybe having conversations directly with families, doing interviews is a better way to capture that experience. And families in that situation can help you understand like that is a decision to be made. So deciding how to collect and analyze the data is a great thing to bring in stakeholders for. Or you might have a new program and the funders really want to look at a specific outcome. Talking with the funders or someone who's connected in that way will help you understand how they want you to collect the data to provide information on that outcome. And then finally, really important is when you go to set the recommendations for program improvement, or you go to set an action plan for how you're going to change or make modifications to a program, this is a really important step for involving stakeholders, because you might have recommendations that you want to make that are not feasible for families, or there might be things that you're missing or ways of going about changing things that a family's experience or another stakeholder's experience could really help you nail down what you want to do with the program going forward. So those are all ways to involve stakeholders, really thinking about them every step in the process instead of just waiting till the end and just sharing out data. Because what will happen a lot of times with program evaluation is you'll see reports shared to the community, right? You'll see like reports of program outcomes or something like similar to that shared out to the community, and the community has very little buy-in to that program. And if you involve them sooner, it increases the buy-in, so it matters more to them. And it also increases the validity of what you come up with and what you share. Okay, so we're gonna take some time to think about that program or service that I mentioned earlier, and think about one or two main goals for that program or service. So once you have those goals in mind, go ahead and type those in the chat box. Think about one or two. So I'll give you an example. Let's see. So there is a program, a new program. It provides parents with a space to meet together and talk about their experiences. The goals of the program might be to, 1, connect parents, and 2, create a space for parents to share resources with one another. So there are 2 goals: connect parents and create a space to share resources. So that's one example. So write out 1 to 2 goals of a program that you have in mind in the chat box, and we're going to practice thinking about how you can create evaluation questions based on those goals. And that will help us develop evaluation plans for programs. So I'll give everybody a couple minutes to think about that and write in the chat box. Okay, there's a couple coming in. This is great. Okay, so sounds like one of the programs is providing group service supports. And the goal of that program is to expand service access to families awaiting individualized services. Okay, that's a great example. The number of others coming in. Okay, so another goal is to provide information to facilities about activities in the community. We have improve socialization for children. It's a goal. Improve children's social interaction skills. Facilitate dissemination of information to providers and families. Okay, so let's see. And then opportunities for peer interaction for EI. Okay, I'm just going to pick one example and we're going to turn it into a question. It's hard to keep up with the chat box. You guys are being very engaging, which is fantastic. Okay, so let's think about the one about information dissemination. So a number of you wrote in the chat box that you have a program and the goal is to provide families or providers with more information about facilities and activities in the community. So let's take that one. Thank you, Kenzie, for sharing. So we have the goal, which is to provide families more information about facilities and activities in the community. I'm going to use my annotation on here to type that out so everyone can see it. Okay, so this is our goal. Now we're going to think about how do we turn this into a question? And the reason we turn it into a question is because it's easier to think about how we would go about answering a question than it is to think about how would we take this goal and turn it into an evaluation. It's really helpful to shift the way we phrase it into a question. So, okay, so what would our question look like? If you have ideas, feel free to write your ideas about what the question might look like in the chat box. But I'm just gonna start off with doing it here. So we want to know, so the program might be like a newsletter. I'm not sure what the program is in this context. So to what extent does, let's call it program X, let's see. So that's a great one. So so some people are thinking about questions in terms of how you might ask them in a survey. We're thinking a little bit differently about questions here. It's more broadly, Jessica typed in the chat box, are families reporting they're aware of activities in their community? So exactly along those lines, to what extent does program X increase families' awareness of facilities and activities available to them in the community? Okay, so the reason I added available to them is because there may be, I imagine the goal is to provide information about facilities and activities that are accessible, inclusive, designed in a way that will meet those families' goals. And so the question includes that as well. So to what extent does this program increase families' awareness of facilities and activities available to them in the community? So that's what we want to know, right? And that's our evaluation question. Okay. So let's try one more, just because I want to give a few examples. So let's choose one other program. Let me see. And thank you guys for the great ideas on the questions. Some of your ideas we may go back to when we talk about like designing survey questions, because some of those are great for that. Let's see. Okay, so this is another program. So it looks like the program is geared around providing services to families with restrictive schedules and those living in areas where services are difficult to procure. Let's see. I want to make sure that I'm understanding that correctly. Okay. So I'm just trying to find that question again. I lost it. Okay. So the goal of this program is to increase the services available to families. So let's type this out. Increase services to families with restrictive schedules and those living in areas where services are difficult. That is the goal. And so we want to know, this will be program Y, I guess. Does program Y increase service, increase services available to families with the restrictive schedules and those living in areas where services are difficult to procure? So the reason this is a simpler question is because the goal is to increase services. So does it increase the services? This first goal, the first program X, goal was to provide families with more information. So to what extent are families more aware? Do they have that information? To what extent do families have that information? Okay, so those are reframing the goals of the program into questions. So what is next? Let me clear, there we go, whoops. Okay. How do we answer the question? That's the big point of evaluation. How are we going to answer these questions? So we want to pick the most feasible options to answer the questions. And so you want it to be feasible and you want it to answer them well. Some examples of methods that you could use to answer the question or the questions: you could use surveys, interviews, observations, focus groups, or analyzing materials that you already have. Excuse me. So let's pick one of those questions and think about how we could choose a method to answer it. Okay, I'm just gonna scroll down. So here are just some of the different methods, which we'll talk about a little bit more in a second. Let's think about the program about increasing family awareness of facilities. I'm gonna type that actually on here and keep it there so we can keep that in mind. So it was, to what extent are families aware of facilities and activities available That's the question that we're going to use right now. It's a great question. So, what is the best way to, oh, this is like, needs to be edited. Whoops. Are families aware? There we go. Okay. So how might we go about answering that? Any ideas, just like based on what you're seeing here in terms of the methods and how you might go about answering that question, what you might use? And there's no right or wrong answers here. There's many ways you could go about doing this. Lots of creative ways as well. But any ideas? We'll talk about some of the different options. So Google Forms, so using surveys, interview and focus groups. Okay, you might interview the parents, yeah. Interviews as well as a survey, focus groups following a survey, great ideas. Survey Monkey, focus groups, talking to service coordinators, so interviewing service coordinators, questionnaires, so surveys again. Great, lots of ideas. Observations with assessment measurement. Okay, so there's a number of ideas. Talking to people, so interviews or focus groups. Okay, so there's two different sides of methods you can use here. And that's where they're organized under the qualitative side and under the quantitative side. Sometimes you can actually, these can kind of swap a little bit. So like you could have a survey that has qualitative questions on it. We'll just talk about what this means. So quantitative data is number data. So we might look at a survey question about how many times did you read or how many newsletters? Let's imagine that program X is a newsletter, and program X provides a newsletter every month on different activities and facilities available to families. Just imagine that. So you might look at you might ask the families in a survey, how many newsletters did you read? And you might just have them input a number, right? Someone is saying in the chat box, how many people actually attended an event? So thinking about, we're looking at awareness, but maybe we also want to ask the question, to what extent are families engaging in activities and facilities in their community? So to what extent are they attending or participating in? So we might look at, right now we're talking about awareness, but we might also look at participation. Awareness is a little bit trickier to look at in terms of numbers, because we're asking about perception, families' perception of what's available to them. But if you, let's say you have a Facebook group and you share the newsletter on the Facebook group, you can actually look at how many people saw that post, how many people shared the post, how many people liked the post, how many people engaged in the post through Facebook data. And so that's going to answer awareness. You're going to see how many people saw that. However, you're not going to see how much they paid attention to it or the extent to which they thought about it, just that they simply saw it. So the level of engagement, the level of significance that it played won't be captured with some of the quantitative data. And that's where the qualitative data comes in. We're really looking at quality and of the data as opposed to simple numbers. So that's where you might have focus groups with parents, and you ask them, well, you ask them, you know, how many of the newsletters did you look at? And what did you think about the newsletters? What information stood out to you in the newsletters? Was there any information that you saved on a calendar? Or was there any event that you considered attending? Then you can just kind of build off of those questions and really get at how significant that program or that newsletter or that Facebook group was in their awareness. So there's those two different sides, right? The quantitative, simply like number data. The qualitative is the quality side, the richer data, but it lacks the number. So sometimes, many times, quantitative data and qualitative data go together really well, because you could see, maybe you found out that your newsletter reached 40 families, and you're in a small county, and that's a lot of families. Or maybe it reached 10 families, and that's 10 more families receiving information that previously didn't have that information. So that's great data, right? You're reaching families, you're meeting that goal, you're making families aware. But you want to know, well, did that matter to them? Did they care? Were they interested in any of the events or any of the activities? Why or why not? That's where the qualitative data comes in. So preparing those two together can be really helpful if you're doing a program evaluation. And many times we call this mixed methods evaluation. Many times evaluations are mixed methods. So if it's not mixed methods, it could be a single methods evaluation where you just get the numbers data or you just have focus groups. Those are fine too, but oftentimes together they're even better. Okay. So let's talk about these different options really briefly as well. So interviews versus focus groups. Interview is going to be one-on-one. Focus group would be similar to an interview. You'd have somebody facilitating, you'd have questions or ideas about questions, and you'd have a group of people in a room together, and you simply have a conversation, and you ask different members questions. And oftentimes in focus groups, you'll have, let's say you have a focus group with parents. the parents will start to talk with each other. They might answer questions for each other or build on what someone else is saying. So you have that group dynamic that takes place, which can either be positive or it can sometimes be negative as well. And so there's important reasons for why you might choose a focus group versus an interview. If we're talking about family awareness, that might be a great opportunity for a focus group. If we're talking about something a little bit more sensitive, like satisfaction with evaluation or something like that, an interview might be a safer option. Depending on how sensitive the topic is, you might want to consider having a one-on-one setting. Or if you're really concerned about the group dynamic, focus groups can also introduce some challenges as well. So there's reasons to go with one versus the other. Although, of course, with a focus group, you have more people at once, so you can collect more data at once. So there is that pro. Observations. This might be you have a parent group that runs once a month, and parents meet and they talk about what's going on in their lives and how their kids are doing and activities they are enjoying. Maybe it's just a parent support group. You might attend the group and take some observations. How are parents engaging with each other? You could simply be observing and taking notes on how things seem to be running. Maybe the goal of the group was for parents to provide resources. So if you notice that's happening, taking notes on that. If you notice other things are happening that you didn't expect, taking notes on that. And also, this just can be a great opportunity to capture what is actually happening in this program. Let's say there's a group service. You're talking about providing group services for children who are waiting for service, for individual service. You might observe how that group service is taking place, how the peers are interacting with each other, how the children are interacting with each other, how the providers are interacting with the children, things like that, just to get a sense of, well, how is this working? Is this working well? So those are observations. Then you have your quantitative data. Most people know about surveys, whether you've taken one or you've given them. There's so many different ways to design surveys. You can use closed-ended questions, which are quantitative. Closed-ended is yes, no, or you have a set list of answers available. So you might have multiple choice, you might have yes, no, you might have a sliding scale of like from 0 to 10, but you have chosen the answers available. Whereas open-ended would be, tell me about your experience. That's open. They can share their experience in that space. And that would actually be a qualitative question. So it's just helpful to think about some of these tools can be used in different ways. So not every survey is purely quantitative. It's not all purely numbers-based. Sometimes you can bring in those open questions and get a lot of rich feedback there. You also have assessment measures. So providers use assessments all the time to track children's progress, to get a baseline measurement, to see where they're at, and to be able to determine, well, what do they need to work on, where are they going. You can also use assessments in evaluation. You could use, maybe you're looking at social engagement. I saw a couple goals listed in programs earlier in the chat box about increasing social engagement with peers or increasing sociability for children. So you might have an assessment measure that specifically looks at the social skills of kids. And that might be what you're looking at for your evaluation. So you might observe social behavior, but then you might have an assessment measure that scores it according to a certain number system, or that captures it through like a standardized measure. And then that would be the quantitative side of things, is if they're getting coded according to like a measure, a number, that's quantitative. If you're just observing their social interactions and taking notes about how their engagement is with each other, that would be the qualitative. And you also have documents that you could analyze. So this could be something like, and it's not always documents, it could be like analyzing data that just exists. For example, like Facebook data on how many families your post about the parent group reached. Or it could be looking at maybe you're collaborating with the preschool and they're taking, they have a daily report and they talk about how social Johnny is with his preschool classmates, and they agree to share that with you, and so you can see, well, how well are we doing in improving his social interaction? So there's a lot of methods you can use, right? I mean, I know when I used to think of the word evaluation before I evaluated things, professionally, I thought of surveys. When you hear the word evaluation, you think survey or questionnaire. It's just the one your mind goes to. But there's so many different options available, and sometimes surveys are the perfect option, and sometimes they're not. Or sometimes you can use surveys along with these other options, and it will just lead to some richer answers to these questions that you have about your program. Okay, how is everybody feeling with this information? Feel free to write in the chat box if things are making sense, if you have questions. This is a lot of information. Program evaluation is a whole field. So these slides will be available, and this is meant to be an introduction and just to get you comfortable with the different options available and thinking about these things. Okay, so let's talk about writing survey questions, because I imagine many of you are going to be doing surveys because it's oftentimes the most feasible answer for what you can get out to the most people, especially right now with everything being virtual. Being able to do observations or other data collection can be challenging. So let's talk about survey questions, because it's really important how you write a survey question. You could have a program where you have two different surveys, and one gives you 0 answers to any of your questions that you really wanted to ask, and the other one with 2 questions, you get tons of really awesome data. So it's really helpful to talk about this. So what you're going to want to think about when it comes to survey questions, there's a few different things. First, you want to keep it specific to one question. And this is really important, because if you ask 2 questions in one question, you don't know which one families are responding to, or providers are responding to, whoever your consumer is. You don't necessarily have the answer to what you're asking. So one example of this is a Likert scale question. Likert scale means, you'll see in the next point, like it ranges from like strongly agree to disagree, or from poor to excellent. It's that scale that you'll see oftentimes on surveys. We call that a Likert scale. And so this first example that I have here is, I feel confident providing EI services to children with autism and working with their families. So this might be, you put a statement on a survey to providers because you want to know how confident are they providing services to children with autism, specifically children with autism. And you also realize, oh, but I also want to know how confident are providers working with their families or working with their caregivers. But you don't want that in the same statement, because if the answers you get are strongly agree or agree, or disagree or strongly disagree, you don't know which sides of that question they're responding to. So if they put strongly disagree, did they mean that they didn't feel confident providing services, or they didn't feel confident working with families? So it's a simple solution here. You just break it up into 2 questions. So I feel confident providing EI services to children with autism. I feel confident working with the families of children with autism. So that's those are 2 different statements. And that way you can assess the answers and which statement they're responding to. So that's just one example, keeping the question specific to one question. Okay, so, excuse me. On the other side of that, you also want to keep the responses in the same direction. What that means is right here, you see, I feel confident. So you would want to keep asking the questions that same way, because one, you're going to make analysis easier. Two, families are going to get less confused. So what this could look like is, so I feel confident providing EI services to children with autism. I feel confident working with the families of children with autism. You don't want to throw in there, I lack confidence, A, B, or C. So you want to keep it in the same direction, meaning that strongly agree is positive and strongly disagree is negative, and it continues along that line. So throughout the survey, unless you switch to a different section. So it's okay to change things around later on in the survey, but if you're in like a Likert scale group of questions, keep them in the same direction. Use Likert scales to make your job easier. Likert scales are an excellent way to capture the range of different feelings people might have about a statement. So an easy way to create a Likert scale. SurveyMonkey makes this really easy. SurveyMonkey is a free survey platform. In the free version, you only have an option to use 10 questions, but your organization may have a paid version, or they may have another survey system that they want you to use. But every survey system, you should be able to use Likert scales. And if they're not an easy feature, you can always just create the Likert scale. So what it looks like is you have your set options, which is going to be strongly agree to strongly disagree, frequently to not at all, poor to or excellent to poor, things like that. And that's your set list of options. And then you have your statements or your questions. So for example, after this webinar, I'll send a survey. And one of the questions is, please rate your overall feelings about the webinar or something. And it ranges from excellent to poor or something like that. So that's how you would create that question. You just have, you'd have your list of statements. So I might say, please rate your satisfaction with the audiovisual components, aka the PowerPoint, for the webinar. And you'd have excellent to poor. And then you also could have a statement, for example, the one above, I feel confident. So you'd have a, your category might be, please answer the questions based on the following statements or something like that. And you'd have your statements. So I feel this way. So in that case, you're having the user, the survey user, envision what they think about a certain question topic. So another example is, I am more, or I have the resources and information, or I have information available to me on activities in my community, something like that. That might be a statement, and you want to know how much do they agree with that statement. So that's another way you can use Likert scales. And there's just so many different options. You could also use them to look at frequency. So how often do you read the early intervention newsletter? I mean, you could have frequently to not at all. And frequently you might want to put month in like parentheses monthly, and then not at all would be like, or never would be another better option. So sometimes you want to provide a little bit more information on what that means. Or like if you have sometimes and they don't really know what sometimes means for reading the newsletter, you might put like every other month, something like that. So that's just like an example of all the different ways you can use Likert scale questions. And then when you're writing survey questions, you really want them to be as simple as possible. So using accessible language, that's really important, especially when we're working with diverse populations. And we want to understand how things are working for them. We want this to be accessible and inclusive to all the families, all the providers that we're working with. So an example of something that might be not very accessible is my self-efficacy and service provision with children with autism and EI is high. That's a lot, the mouthful. Self-efficacy is not something everybody knows. Service provision, what does that mean? Using EI is using an acronym. So even though we know what EI, early intervention, is, not everybody has that in their go-to vocabulary, especially if we're talking about, you know, families that have a lot going on. They may be new to early intervention, and EI just kind of goes over their head when they read that. So avoiding things like acronyms, keeping words really simple, and also just making sure that you just keep it as simple as possible so that it's accessible to everybody. Okay, and then I talked about closed-ended versus open-ended questions earlier. Closed-ended, all of the ones above are closed-ended. So Likert scales are closed-ended because you choose the answers available. Open-ended would be something like, do you have any additional comments? Tell us about your experience. How satisfied were you with the experience? Anything else you would like to add? Anything that creates a comment box or a text box where the answers aren't pre-chosen is open-ended. And then the last recommendation for writing survey questions that I have is always add a box of comments for the end so that families can add, families or providers or whoever you're serving can add their thoughts or experiences. If they felt like, if they're completing the survey, they're using their time to provide you with feedback. And if they feel like the feedback that they want to provide doesn't even, like, it's not even an option to them to provide their actual feedback because the questions are so limited with what they can share, that's going to be a frustrating experience. So always allow them to have a space to just share something that wasn't asked that they want to share. And oftentimes you can get really helpful information in that final question of, do you have any additional comments? Anything else you'd like to add? You can get really encouraging information like, this program has changed my life or changed my child's life, or something that really provides information about accessibility. Like, I love this program, but my schedule and doesn't work with the location of this program, or something like that. Sometimes it's just really helpful to have that additional question. Okay, so we talked a little bit about observations. We're going to talk just a little bit more about what that looks like. So observations can be a really great way to see how a program impacts day-to-day activity. They can work well when you already have staff at an event or like a program, and they're able to take into account what's taking place there. So how do you take them? How do you take observational notes? So they should be detailed and specific to what is taking place. You're wanting to describe things like behaviors, actions, interactions amongst people there, things like that. Really looking at the question that you have about the program. So how are families aware of facilities and activities available to them in their community? So let's say you attend a parent meetup and you provide that newsletter to all of them. And then you observe their conversations around the newsletter as they're in a group together. So maybe they're talking about it like, oh, this looks really cool. I'm free. Are you interested in going to this event with me? Writing that down on an observational note, like parent showed interest in event and connected with another parent about it. You could even like try to write down word for word what they said as quickly as possible. You could, let's say the parents, they connected, they both wanted to attend an event based on the newsletter, and they wrote down each other's phone numbers. That's a great behavior interaction to write down. So all different ideas for how you can take some notes. Again, thinking about, there's also a lot of benefits of using shorthand. When you're taking notes, things happen fast. And so just using like just abbreviations in shorthand as much as possible, knowing that you can type these up later or you can detail them later. And then keeping them all in one space so that you don't lose them is a great idea. So having a little notebook that you have with you when you attend these meetings, so that you can take the observational notes in that notebook and type them up later. Thinking about how quickly you want to type them up so that they can be secure and you don't lose them. And then another option, you can either do this in conjunction with taking observational notes or in substitution, would be to create a memo afterwards. A memo is basically like a journal entry. It's kind of like a diary entry for a program data. So let's say your staff member, you attended a group therapy or a group intervention session, and you notice that the peers interacted really well together with each other. The children were interacting well with each other, but the provider had a difficult time providing the service because of all of that social interaction that was taking place. And so you just take a quick journal entry about what you observed, the challenges, the strengths, and then maybe some things that were on your mind so you don't forget that later. And that's a really great idea just in general, to be writing memos or to be writing notes or a journal entry about our programs, because there's things we think, oh, I'm going to remember that. I know I noticed this, I'll remember it. And then we forget it because we have so many things in our minds. So memos are an excellent way to remember. So thinking about another example of an observation. So you might have a program that provides parents with a space to connect. And during the program, you notice one parent is kind of isolated and hasn't really engaged. And you might write a note about that. Write a note about certain parents, or like parent A was unengaged with the group and seemed isolated. What that can tell you is maybe we need to do more facilitation with this parent group to support the engagement for people who are struggling to do that on their own. So it can tell you really important information. Another example might be you see two parents that are chatting and they notice that they both love to garden. So they're talking about gardening together. And so you notice, wow, parents are connecting around shared interests. Great opportunity to think about how you can facilitate a group that brings up shared interests or asks families to share fun facts, different things like that, so parents can kind of get to know the shared interests if it's not happening organically. So these notes can give you a lot of information about how things might get better, how things are going, ways you can make improvements. It can be really helpful data. Okay, so when it comes to collecting the data, you want to have a plan before. Who is doing this? Who's making the survey? Who's going to keep track of the responses? Who is going to be looking at the data when it comes in? How is it going to be collected? Are you having paper surveys? Because paper surveys sometimes are the best option, but they can also get lost or misplaced or not entered correctly. And so it's really important, like, you're thinking about these questions beforehand. So who's responsible for collecting it? How is it going to be recorded? Where is it going to be stored? You want to be really careful if you're collecting any kind of personal information that it's stored in a safe location. You want to avoid collecting any personal health information or identifiable information when keeping data. So that's just extremely important. So you want to store it in a safe location, but also avoiding personal health information or identifiers is important. Another example of why this is important, maybe you have a program and you really want to look at change over time in like the parent awareness of, let's say, accessible community events. So you're wanting to look at parent awareness and you want to measure a baseline. Well, if you start the program and you never took the baseline, you never did a pre-test or a pre-survey, it's too late. You can't get it back. It's impossible once the program's already started to get it back. So you want to have the data plan before you start. And organization of your data is key to ensure the evaluation will run smoothly. So it's just really important to think about these things beforehand. Okay, so we're getting to the end, kind of. Seems like we're gonna go till about 3:30. So you have the data, what's next? So you have to analyze the data, right? It can just, there's no point in collecting the data if you're not going to use it. So you have your data, and the data hopefully leads to knowledge about your program, and that hopefully leads to action. So on a simple level, if you're using SurveyMonkey, you can go into the Analyze section, and you can take a look at the findings, jot down some notes, specifically keeping in mind the questions you had asked. And so you have your main question here: to what extent are families aware of facilities and activities available to them in their community? You have your survey questions. Let's say you have Likert scale questions about awareness. You have also some questions about using certain resources in the community or attending certain events. You have open-ended questions where families were able to share events that they attended, or barriers to attending, barriers to accessing things in their community. And you're taking a look at the data, and you're looking at all of that and trying to sort it out and trying to figure out, well, what matters here? So again, the SurveyMonkey can be a great tool, and it can be really easy because they actually will provide you with the graphs, the charts, but you can also export all the data and all the responses. Typically what I do when I do any sort of evaluation is just the full data export, and then look at it and organize it myself the way I want to see it. That's more complicated though. So it just depends on what you're planning to use the data for. And then on a little bit more complicated of a level, qualitative data can be a little trickier to analyze if you actually want to like systematically analyze the data. So first, let's say you have a focus group. First, you have to transcribe the focus group. So you have this audio file of all the things families said, and then you have to turn that audio file into text. You can send it to transcribers, or you can do it yourself by hand on a computer. Or you can just take really detailed notes during the focus group and use that to analyze. And then once you have the text, you're going to turn it into like codes or themes. Maybe the families talked a lot about how they have so much going on in their lives, they're really struggling to prioritize recreational activity. So you might have like challenges or barriers to recreation might be like a theme that you capture from that focus group. And then it can be so, you can go crazy with your themes, and they can be all across the board, but keep in mind, what are you wanting to know? You're wanting to know, are families aware of facilities and activities available to them in their community? So looking at awareness, trying to capture the themes that fall under that idea. So maybe families share, I learned so much about the local YMCA and what they have to offer. It's perfect quote that you can capture about awareness. So like learning about community resources or something like that could be the theme that you capture there. So it can get, analyzing the data can be really complicated, or it can be really simple. Just depends on what you're trying to accomplish. Okay. And then you want to share what you found, right? So you present your findings. You want to think about, who are you going to share this with? Are you just sharing it with funding sources? Are you just sharing it with your organization? Or do you want to share it back to the family? Do you want to share it back to other providers? Do you want the schools to know about this? Do you want service coordinators to know about this? Think about who you want to share it with and who it's relevant for. And then you have to decide, well, how can I make sure this is accessible to others? Using accessible language, using visuals like graphs and charts, and maybe word clouds that are accessible and inclusive. And then there's so many different options for how you share your findings, right? You can have a presentation, you can have a meeting, a community meeting. You can have a simple conversation where you share your findings with someone, or you can use more a formal report as well as like a visual report. I can show you an example of a visual report in a minute. And you can even share it with families, of course, right? You can have maybe a section in your monthly newsletter where you share out about program outcomes, and you have like three things you share about that program that you found out through an evaluation. So you really want to consider how you can share the findings with all the parties who are involved in the evaluation, as well as the program, aka your stakeholders. And there are many different ways you can share these depending on the population. You can share them in a brief one-page document to families, or you can go through like a thorough presentation with EI providers. It really depends. A lot of this depends, of course. And once you have your findings and you've shared them out, of course you want to consider how are you going to act on these findings. Recommendations are useful for an ongoing program or a developing program, or when you're planning to expand a program. It's not so useful when a program is ending, but you could use a section like areas of improvement or things to consider. Most importantly, when it comes to taking action, you don't want to take on too much too soon, and you don't want to take on something that's not feasible for your organization. So there's a million things you could do, right, to improve your programs, but what is going to give you the most bang for your buck? What's going to be able to be most feasible for you to implement? What's actionable? What can you actually do? So how are you going to do this? You want to choose actionable recommendations. So you're noticing families are really struggling with communication barriers with EI providers, or maybe families are really struggling to know what's going on in their community. And so you decide we're going to start a newsletter. We're going to make this inclusive newsletter that we're going to share out. We're going to post it on our Facebook page. We're going to send it by email. We're going to print it out for families and give it to them during services. You have all these different ways you're going to get it to families. That's actionable because a newsletter is something that is, well, it may be actionable. There may be times where that's not so actionable because your organization is stretched so thin, you really don't have that possibility. So maybe a newsletter is too much, but you have a Facebook page and you could do a weekly post. So there's different ways you could address communication at different levels of what's actionable for your organization. And the other thing you really want to think about when it comes to recommendations is if they are actionable, you want to set a time frame for when they will happen and who will be responsible. So if you create like this person's responsible, or these 3 people are responsible for working together on this by October 2020, then you have a time frame and you have accountability. So that's really important. So to ensure things are actionable, you have to create that accountability. Okay, so just real briefly, because we're almost wrapping up here, and feel free to post any questions you have about this presentation as a whole in the chat box now that we're getting to the last few minutes. Here are some barriers to evaluation. You can write in the chat box ones that are specific, that you've noticed specifically in your experience or your organization. Okay, you can highlight some in the chat box. Too challenging, limited time, limited resources. You might already think you're doing a great job. You don't need to evaluate it. No one reads the reports. Poor planning. You're mandated to do it, but it's not something you want to do. There are unrealistic targets or goals for the program, and you know that it's just unrealistic. How are we supposed to measure that? So these are all just some barriers, like some preconceived barriers. And of course, there are different ways to navigate these barriers. So let's talk about that real briefly. So choosing the right type of evaluation, we talked about process, development, outcome earlier. You want to choose the right type to address some of those barriers. Providing training to, right now we're doing webinars, this is training on evaluation. So training your team on the importance of evaluation, building it into your existing processes and existing methods. So if you have evaluation built into every program you run, just becomes a part of the natural process and less overwhelming and just more part of protocol. You build in feedback loops for your program, quality improvement measures, creating an evaluation plan when you're planning the project, the beginning stages of the project, making it useful for everybody so that the information is usable and actionable and everybody has buy-in, creating realistic objectives and timeframes, and involving key stakeholders from the outset. So those are just some really awesome, great ways to address some of those barriers for the evaluation. Okay, let's see. Okay, so any questions before we wrap up? I'll give you guys a couple of minutes to ask questions in the chat. But I appreciate all the engagement that you provided throughout. So next is, of course, an evaluation of this presentation. You cannot have a program evaluation presentation or course or training without evaluating it. So I'm using a survey, a very brief survey, mostly with Likert scale questions that you'll notice. And then there's one open-ended question at the end, of course. So please complete the survey and actually wait to complete it. Don't complete it just yet. I have to add a field for name, first and last name, and email so that I can make sure that I can create your certificates of completion for participating in the webinar. So wait until I email this out to complete it because I want to make sure it's actually ready to go. Okay, everybody, well, that's all I have for you for today. And if there are no questions, I don't see any in the comments, we're all wrapped up and we used the full time. So thank you all for being here. Thank you for your engagement. I will email the survey to all of you in just a minute. So, okay. Thank you, everybody.